Hey everyone, welcome back to the channel. In today's lecture, we're going to take a closer look at a soft tissue lesion that shows up pretty often in the floor of the mouth. It's called a ranula. It's basically a type of mucocele, but it has a few unique features that make it worth looking at separately. We'll go over how it forms, what it looks like, how to diagnose it, and how to manage it, especially how to tell it apart from other similar swellings in that area. So yeah, let's just get into it. A ranula is basically a mucus extravasation lesion. That just means mucin leaks out of a damaged salivary gland duct, usually from the sublingual gland, and it pools into the surrounding tissue. It's not a true cyst because there's no epithelial lining. And actually, the name ranula comes from the Latin word rana, meaning frog, because the swelling under the tongue kind of looks like a frog's belly, like translucent and dome shaped. Now, clinically, it usually shows up as this smooth, bluish, dome-like swelling in the floor of the mouth. If it's close to the surface, it's like bluish and translucent. But if it's deeper, you might not see the color. It could just look pale or even normal in color. The size varies a lot. It can be just a few millimeters or even several centimeters. Some get big enough to push the tongue up, which can mess with speech or swallowing. And if it spreads down through the mylohyoid muscle into the neck, we call that a plunging ranula or cervical ranula. Now, one tricky part is that the size can change. It might burst and shrink, then come back again later. And it's usually painless unless it gets infected. Also, it's typically off to one side, not right in the midline, which helps you rule out things like dermoid cysts that are usually centered. As for how it forms, it's usually some kind of minor trauma to the floor of the mouth. That trauma damages a duct, like from the sublingual gland, and then mucin leaks out. The body reacts with inflammation and granulation tissue builds up around the mucin. That's what creates the swelling. And while it's usually the sublingual gland, sometimes it's the submandibular duct or even small accessory glands. In rare cases, it can spread further back into the parapharyngeal space, and that's when you might get more complex symptoms. The fluid inside is usually thick and jelly-like. People compare it to raw egg white. And histologically, it's just spilled mucin surrounded by granulation tissue, and you'll usually see foamy macrophages in there too. Ranulas are more common in kids and young adults. No real gender difference. Most of the time, you'll see a painless, soft, fluctuant swelling off to one side of the lingual frenulum. The mucosa over it is mobile and not ulcerated. You can usually get a positive fluctuation and transillumination test. And unless it's infected, cervical lymph nodes aren't involved. Now, other things can totally look like a ranula, like dermoid cysts, salivary duct cysts, cystic hygromas, or even in rare cases, tumors like squamous cell carcinoma that block ducts. So if the diagnosis isn't clear, especially with deeper or plunging ones, ultrasound or MRI can really help. As for treatment, well, if the lesion's small and not causing problems, sometimes observation is enough. But for symptomatic or recurrent cases, the best option is to surgically remove the sublingual gland, since that's the source of the mucin. That's the most definitive. Another option is marsupialization, where you create a drainage path into the mouth, but that's usually more effective when you also remove the gland. Complications aren't super common, but they do happen, like infection, repeated trauma, or recurrence if you don't get the whole gland out. And the bigger ones can cause functional issues, trouble swallowing, speech changes if they start pressing on stuff. So yeah, that's a full but kind of trimmed down overview of ranulas, how they form, how they look, what to keep in mind clinically, and how we deal with them. Really important to recognize these early and differentiate them from other cystic lesions. Thanks so much for tuning in. If this helped, hit that like button, subscribe for more clinical breakdowns, and drop a comment if there's another lesion you want me to cover. See you next time.